Tanya Ross of TBR Academy of Movement and Therapy. So we're going to take you in this video through the musculocutaneous like self-help strategies if you have tested positive in the active test that you can do yourself. So if you've checked out that video, it's come up as a positive for nervy symptoms when you do that test, then we're going to take you through a couple of movements that you may find useful. Same as with every other one that we've put across, I want you to keep the rep range to around about 10 maximum, making sure you're not recreating symptoms, you're going to an edge, and then you can gradually start to increase to 20 over the course of the week. So with this, we're going to just make, again, a bit of a loose fist. You can do this with the thumb in or with the thumb out. So we're just running on the spot, but I suggest maybe keep the thumb in, loose fist, and you're just running on the spot with the arm action. So you do both at the same time, and that way we're getting a comparable. If you find that you are wanting just to pick up on what you feel more on one side than the other, because it's harder to sense with both, then certainly do one side, but make sure you do 10 on one, 10 on the other, or if you're alternating, you're doing for 20. So you're bringing it into that extension through the shoulder, taking the arm in behind, keeping that wrist on. And that, not the ulnar deviation, but just again with the thumb in and the fingers loosely around it. So we're just picking part of that movement and mobilizing it. So hopefully you don't feel anything, take it to the edge. You don't have to take the movement as far behind if that doesn't work for you in terms of range of movement, not only structurally from a joint or a muscle perspective, but also in terms of the nervy symptoms. So give it a go and hopefully it helps. Leave us a like, leave us a comment, and certainly subscribe. But otherwise you can take it through into the next video and you can try this next movement as a suggestion as well to help. But any irritation, please make sure to book in and see a medical professional. Okay, thanks for watching.